Hey, you know, Tim showed us a great place to visit to feel younger. But if you want to look younger, years younger, your fountain of youth could be just a doctor's appointment away. Dr. Christopher Hobie, a facial plastic surgeon from Monarch Med Spa, is here to show us how surgical procedures are helping some women look 15 years younger. Is that true?
That's right. That's exactly right.
15 years younger?
15 years. In some cases, it can be a little bit more than that.
Yeah.
Depending on your anatomy. Absolutely.
And do most people come to you and say, I just want to feel younger? Or do they have an idea of what it is they want done?
Most people have a particular idea in mind. They don't come in and saying, I need to be X number of years.
Yeah.
And they just, you know, a lot of them come in and they say, you know what, I feel younger than I look. And I really want to kind of match the way that I feel. I don't want to look, you know, 20 because most people don't know them as 20-year-olds. They want to look appropriate. And that's our goal. We want to keep things natural. We want to make things look non-surgical.
Yeah, well,
not plastic.
I think the proof is in the showing.
Right.
So let's show an example of rhinoplasty.
Sure, okay.
And so basically we're just talking about a little, what is that, little face?
Well, that actually with her, her profile, now keep in mind that a lot of people, you can't transmit through pictures what people want. So when we're looking at these, just be careful of that.
So the left is the before.
Left is before, yep. She just wanted a reduction of some of the convexity, the hump on the top of the nose. And she wanted the nose, the tip of the nose to be closer to her face. And that's really what we achieved.
You accomplished that.
Yes.
All right, just looking at the picture, you accomplished that. Our next is a neck lift, which I know is a problem for a lot of women.
That's exactly
and men.
right. That's exactly right.
But we get that little piece at the bottom.
Yeah, the unfortunate thing called a turkey waddle. Or,
yeah, I wasn't going to say that.
Yeah.
But
that's
on
what
the
it's
left,
commonly referred to.
You can see that the right is dramatically different.
Absolutely. So yeah, she had a neck lift, reduction of some of the jawline, the jowls there, so tightening along the jawline, and then most importantly, like you said, reduction of some of that fullness.
How long does something like that take? I mean, like if I come in, and for instance, we've got a lip there right now, a lip augmentation.
That's right.
She had thinner lips, wanted larger lips.
That's right.
If she comes in to get that done, when can she go back to the grocery store?
Well, something like this is fairly straightforward. This takes about 15 minutes to do, and she can go right back to her daily activities out of the office. Absolutely.
What about the neck lift?
The neck lift a little bit more involved. Obviously, the procedure itself takes between about 1 to 2 hours, depending on what we need to do, and then they'll feel comfortable going back to work closer to about a week.
Now you do something called an awake lift.
Yes.
What is that? What does that mean?
Well, it's not one specific procedure per se. It's basically our approach to each patient. And when a patient comes in, we have to evaluate their anatomy and determine what's going to give them the results that they're looking for.
And when I say awake, what we're talking about is anesthesia, whether you're going to have to knock them out to get this done or whether you can do it under local.
That's right. So when we do things under local anesthesia, that is termed the awake lift. And there's a lot that you can do under local, and a lot of surgeons aren't necessarily comfortable doing that. Some surgeons are. It depends on their training and their abilities as well. So.
But you have those at Monarch who can do whatever it is you need them to do.
Absolutely.
Now we actually have Arlene Kirkwood, who is she one of your patients?
Absolutely, yeah. We did her about 3 weeks ago, I believe,
this is the before of Arlene. And now let's look at the after. What did she have done? Well, the after is right there in person.
Yep.
Fabulous. Arlene, what did you have done?
I had a chemical peel, I had upper eyelid surgery, and I had the awake lift, the mini lift, yes.
Okay, now I got to tell you, anything that says chemical peel sounds painful, but obviously it wasn't because you're here and smiling and...
Absolutely, honestly, nothing was painful.
Yeah.
And I was awake.
You were awake?
Absolutely.
Okay, and is this the first time that you've had anything done?
Yes, it is.
And how do you feel?
Wonderful. I was ready to go in a week.
Yeah.
Go back.
Do you feel different when you look in the mirror, Arlene? That's the true test.
That's right.
Yes.
Yeah.
I don't see the hanging jowls or the neck, so I feel much better, and I look. I don't look as tired. I feel like I look refreshed.
You do.
Which is what I was going for, the refreshed. I have students. I'm a teacher, and they go, "You look tired." I
Oh.
I'm not tired. I'm just old.
Well, not anymore, Arlene.
Okay.
They're going to look at you and say, wow, Miss Arlene, fabulous. Thank you so much for being here.
Thank you.
And thank you as
Thank
well,
you.
Monarch Med Spa.
Yes.
And for more information, of course, you can head to our website, NBCPhiladelphia.com. Dr. Christopher Hovey, thanks so much for being here.
Great. Thank you.
Up next on the 10 Show, it's the local comedian who found international success poking fun at his old school Italian family. Don't miss